This is our presentation about sleep apnea by Alex Garibay, Zach Lancaster, and Tyler Lefebvre. First, what is sleep apnea? A quick definition of sleep apnea is a sleep disorder where one or more pauses of breath while sleeping that can last from a few seconds to minutes causes increased carbon dioxide and decreased oxygen levels in the blood. This disruption occurs at least 5 times per hour, but may occur as many as 30 times per hour. Sleep apnea is one of many sleep disorders that can occur and affects millions of people. It is a chronic condition that disrupts you by moving you out of your deep sleep, causing poor sleep quality, leading to tiredness and inefficiency in the following day. Sleep apnea often goes undiagnosed because the patient doesn't know that they have these problems unless told by someone else. There are 3 common types of sleep apnea. The first is central sleep apnea, which is the least common of the 3. Central sleep apnea is a disorder of the brain. It actually is a couple different things. First, the chemoreceptors in the blood do not recognize the elevated levels of carbon dioxide, so there's no signal sent to the brain that carbon dioxide is increased, and thus there's no signal sent to the muscles that control the breathing to take a breath to inhale fresh oxygen. That's central sleep apnea. The more common of the 3 types is obstructive sleep apnea. Obstructive can be caused by any blockage of the airway passage. Treatment for this is required to prevent hypoxic conditions. The final type is complex sleep apnea, which is just a mix of the other 2. In this slide here, this is just an example of a person with sleep apnea and how long they can go without taking a breath. As you can see from that video, you can go for long periods of time without breathing at all, which can be very dangerous, and this happens multiple times every hour for a person with sleep apnea.
So here we have from the National Health Institute some suggestions on amount of sleep you need as you get older. As you can see, newborns need quite a bit of sleep, but that decreases as you increase with age. But as you can see here, as an adult, you still need about 7 to 8 hours of sleep, which is a pretty good amount. This does not take into account any napping or any sleeping in. This is only nighttime sleeping, so you can't really make this up in terms of a nap during the day or just trying to sleep in on the weekends. This is 7 to 8 hours every night, and you want to try to sleep in the same pattern every night to try to keep those levels going. So some other guidelines they have are trying to prevent blue light at least an hour before going to bed, and avoiding alcohol or nicotine before bedtime, trying to exercise outside for at least 20 to 30 minutes every day, and limit your naps to 20 minutes or less. All of these guidelines and recommendations go to increasing productivity the next day. They promote healthy brain function and emotional well-being, improved physical health. So
here's a little information on sleep disorders in the U.S. Sleep disorders in general affect 50 to 70 million adults in the U.S. There's a bunch of information on just sleep disorders in general on here, but sleep apnea affects about 12 to 18 million within the U.S., and sleep disorders in general have a big impact on our lives and economy, with 50 billion in lost productivity through people being tired throughout the day, and 5,000 to 6,000 fatal crashes from people being drowsy at the wheel. It seems like from this study from the National Health Institute, that it's more prevalent in women, and just in general, that sleep disorders affect a lot of Americans, but not only Americans, but everywhere.
So, like you said, sleep apnea is one kind of sleep disorder. A few risk factors for sleep apnea are increased age. With that is loss of muscle tone as you age, and so that can affect some of the breathing signals at night. Obesity, and as you see with the little diagram on the right, the obesity can kind of be a cyclical thing with sleep apnea, and as you get obese, it changes your upper airway shape and reduces the amount of the amount of air you're able to take in, which thus decreases your physical activity, decreases insulin resistance, leading to more obesity, and it just compounds on each other. A few other things such as neck circumference, a neck size of at least 17 in men or 15 in women is a risk factor. Men are affected slightly more than women. Metabolic syndromes are risk factors, things such as diabetes, strokes, other heart diseases, all are risk factors for sleep apnea. And then especially with the obstructive sleep apnea are things such as small airways, allergies, and enlarged tonsils. Just really anything that narrows the lumen of the airway while you're sleeping.
So some signs and symptoms of sleep apnea. As you can see here, loud snoring, breathing cessation during sleeping, abrupt awakenings, insomnia, hypersomnia, which is sleepiness during the day, headaches upon awakening, dry mouth, sore throat upon awakening, and irritability. Many of these factors are not going to be noticed by the person who has sleep apnea. These are going to be more noticed by a partner that you're having to be sleeping with. This is partially why it goes undiagnosed in so many patients, just because the person themselves are not going to be able to notice these signs and symptoms.
So here are the effects of sleep apnea. In general, sleep apnea increases your risk of certain diseases like the metabolic diseases that you see here, high blood pressure, stroke, heart attack, but it also will make them worse if you have them in general. So hypertension will get worse in a person with sleep apnea and will lead to some of the eye signs that we see here. But sleep apnea can also cause stroke, which is the second leading cause of death worldwide. And it increases the risk for both men and women. It was previously only thought to be in men who had the increase, but it is found in women with severe sleep apnea that it also has a large impact on their risk of stroke. And in men, it's progressive over time. So as you've had the obstructive sleep disorder for longer, it increases your risk for stroke. The heart attack and arrhythmia that you see there they thought to be caused by the decreased oxygen levels, which causes a release of stress hormones, which raises the heart rate and causes the risk for these factors. And then the diabetes can also lead to other ocular problems that we see there. So like I said, it's thought that the problems that you have here are from the changes in blood oxygen levels and blood carbon dioxide levels. And the problems that you see there with the eyes are what we're going to talk about here shortly.
Sleep apnea diagnosis and treatment. The first couple things on this slide are the ways it is diagnosed, oximetry and polysomnogram. So oximetry is a little bit easier for the patient. It's just a little home monitor system that measures the levels of oxygen while you're sleeping. It's not as sensitive as the polysomnogram is, but it is a little bit easier option for the patient. The other, like I said, is the polysomnogram, and this is what is known as a sleep study. It records multiple things such as brain activity, eye movement, blood pressure, heart rate, air movement, oxygen levels. All those things are measured while you're in the sleep study. This is usually part of a 2-part night study. So the first night is to actually diagnose that you officially have sleep apnea, and so it measures all those things the first night and checks on them all, and then the doctor analyzes all the recordings to say, yes, you do have sleep apnea. In the second night, it is more of a treatment night, and They hook you up with a continuous positive airway pressure machine, also known as CPAP, and they try to adjust those levels to get the pressure into your airway passage at the sufficient amount needed for you. So with that, other ways of treatment is just through a physical exam and lifestyle changes. So things such as eating healthier, exercising, losing weight, quit smoking, those things all are very beneficial to treating sleep apnea and can help. Surgery may be needed for any blockage of the air passageway, such as enlarged tonsils or a narrow airway. They can widen that to help the air get out or air get in and out while you're sleeping. If you have central sleep apnea, this is usually seen in people that are very sick and have serious brain issues. It is a problem of the brain stem. And so this is a very serious condition that is sent to neurologists, but there isn't a lot that can be done for it. Mouthpiece can be used also to help widen the air passageway. And then, as I mentioned, the CPAP machine, it just is a continuous pressure blown usually into the nostrils to help keep the passageway open, and so that way there's nothing blocking it while you're sleeping.
So the first of the eye conditions we're going to talk about here that are common with sleep apnea is papilledema. And this is going to be a little bit different than regular pseudotumor cerebri. The proposed mechanism is that papilledema due to sleep apnea is due to episodic nocturnal hypoxia and hypercarbia. This leads to an increase in carbon dioxide in the blood and increased venous blood flow, which all works together to leading to increased intracranial pressure. So as you can see here, this condition is usually going to be seen bilaterally in patients with sleep apnea. And when these patients are sent for a spinal tap to check the central serous fluid, daytime levels are usually going to be pretty normal. It's at night that those levels are pretty variable. Patients with papilledema here may be at an increased risk of losing sight as compared to pseudotumor cerebri due to the associated hypoxia. So these patients that present with papilledema may be wise to be sent for a sleep study, especially if they're going to be seen outside of the normal demographic that you see pseudotumor cerebri in, which is going to be overweight females in childbearing ages.
The next eye condition that we're going to talk about here is glaucoma. And we all have seen glaucoma by now, but in general it is a degeneration of the retinal ganglion cells, which comes with the characteristic visual field defects and constriction. And you also see the cupping there and the other normal signs of glaucoma. What's particular about this is that they think that it's caused by the insufficient blood supply to nourish the retinal nerve fiber layer and the optic nerve. So those repetitive and prolonged episodes of when the patient isn't breathing causes the optic nerve and the retinal ganglion cells to not get the sufficient amount of blood and oxygen. So that leads to the retinal ganglion cell layer dying. And in this was a meta-analysis study here, and what they found was that there's a 65% increased risk of glaucoma compared to a normal patient if they have the sleep apnea. So basically what that tells us is that if your patient has sleep apnea, then you should definitely run a OCT, which should at some point be considered part of standard of care with sleep apnea patients, just so you can get a jump on whether or not they're progressing towards glaucoma or seeing any signs of glaucoma. The next condition is non-arteritic anterior ischemic optic neuropathy. And so NAION, which we have all heard about, is sudden, painless, mostly irreversible, and generally non-progressive visual loss, with the normal signs of nerve fiber bundle layer defects, APD, and optic disc edema. And once again, this is thought to be due to the impaired blood flow to the optic disc and the nerve's fiber layer there. And And so they found that in patients who have NAION, in the study that they did, they found that in patients 45 to 64, about 50% of patients with NAION had sleep apnea, whereas in a general prevalence study, only 10% had sleep apnea. So it just shows that if you have sleep apnea, you're very definitely at risk for NAION. And in patients that are 64 years or older, they had an 89% of patients with NAION had sleep apnea. So there's just a much greater risk to have NAION if you have sleep apnea due to the insufficient blood flow to the optic nerve.
So possibly the most common eye condition we see with sleep apnea is floppy eyelid syndrome, and this is going to be more common in middle-aged men. It is characterized by easily everted upper lids, and there's two theories to kind of explain floppy eyelid syndrome. The first is just a weak tarsal plate, and that's going to be common in your obese patients. The second is sleep apnea may cause a decrease in cortical arousability. So when you're asleep and you have mechanical pressure on the eye or on an open eye, that's usually going to cause you to wake up due to the feeling of something on your eye there. And this is not going to happen with sleep apnea. They're going to stay asleep. So the eyelid remaining open after time will just cause the eyelids to become more lax and easily everted with time. So this may lead to exposure keratopathy and chronic conjunctivitis if the eye is going to be open during the night. And we can see here it's recommended to send patients with signs of lid laxity, especially older men that have sleep apnea risks, for a possible sleep study. And treatment would be just with artificial tears. You want to treat the symptoms of exposure keratopathy.
Finally, a few clinical pearls here. First is if you see somebody that looks similar to this guy here, you may want to ask about sleep apnea as they're coming into your office and you're taking history. And you want to know the eye conditions outlined here, such as papilledema, glaucoma, NAION, floppy eyelid syndrome, and CSR, have a high correlation with patients that have sleep apnea. Nearly 2/3 of all patients with CSR had sleep apnea. So if you have a patient that has CSR, you may want to probe into that more and see if they have ever been diagnosed with sleep apnea. And if not, you may refer them for a sleep study for the condition. Similar with glaucoma, patients that have sleep apnea, like Tyler said, have that 65% increased chance. So you may want to just run OCTs on sleep apnea patients, checking for glaucoma because they are at a higher risk. Also, patients with floppy eyelid syndrome and uncharacteristic papilledema patients, as in those who do not fit the pseudotumor cerebri patient characteristics, you may want to send those for a sleep study if you find that to search for any sort of sleep disorder, especially obstructive sleep apnea. And finally, here are our references.
Thank you.